Hi, everyone. Good afternoon or good morning, wherever you are. We're going to get started. My name is Betsy Alafaginas, and I'm the Communications and Membership Manager at PAA. Thank you for joining us today to get an update from our Government Affairs team. Mary Jo will go through her presentation, and she will take questions at the end. So if you could um, ask your questions through the chat feature or the Q&A feature. And at the end of the presentation, I will come back and moderate those questions to Mary Jo, or we will post your email address if you have any questions you want to ask offline. This is being recorded for people to view later and for you to share, but we will shut off the recording before the question and answer session. So first of all, I wanted to introduce Will Dow, who's a professor at UC Berkeley and the director of the Center on the Economics and Demography of Aging, and our current chair of the Government and Public Affairs Committee for PAA and APC. So take it away, Will.
Thank you so much, Betsy, and thank you everyone for joining today. So on behalf of your PAA Government and Public Affairs Committee, we're very pleased to be here to share an update with you on some of our government and public affairs outreach. You have a very active PAA committee that's been meeting sort of regularly to discuss ways to respond to all of the activity that's going on in Washington. But really, we're all leaning on Mary Jo Mitchell, who is our Director of Government Affairs for PAA, longtime Director of Government Affairs, is just super well respected in Washington, in the community, is working to advocate on behalf of research and on data for the population sciences. So without further ado, take it away, Mary Jo. Thank you.
Thank you, Will, and thank you for your leadership of the Government and Public Affairs Committee. Couldn't do it without you. All right, so I am looking to share my presentation with you, and I assume you guys can see that. Yes?
Yep,
I wish I could.
maybe popped up on another screen. Oh, it
Yeah,
says it's the end of slideshow.
we'll
So you
go
probably
back
have to
to
go
the
back.
beginning of the slideshow from the beginning. There we are. Okay, everyone. Will's already introduced me, so we'll just move right through this. I'm going to cover a lot of information during today's presentation, which is going to be organized under these 5 major headings. As Betsy said, this recording of this presentation will be made available, as well as the slides, and we'll advertising it through the next PA newsletter and other forums, so you won't miss a thing. First, I want to provide some context-setting slides to remind everyone about the current national political landscape. As you know, in Congress, the Republicans have the majority in both the House and Senate, but the margins are relatively tight, especially in the House, where the margins keep shifting. There are currently 6 vacancies in the House due to deaths and retirements, and several special elections are happening this fall to fill some of these seats. I actually live in the district where one of those special elections is happening, and I've made it a point to meet the candidates who are running and to let them know about PAA and some of the concerns I have. If you happen to live in such a district where a special election is occurring this fall, I encourage you to do the same, and certainly to use the materials that PAA has provided, including our welcome letter, which really lays out what PAA is, and provides examples of how we rely on federal scientific agencies and statistical agencies to conduct our research training, and produce important scientific findings. With the new Republican majority in the Senate came new leadership of committees. This slide features the leaders of 3 committees that are responsible for funding and overseeing federal scientific research and statistical agencies that are really important to PAA. One committee that's not listed here is the Senate Homeland Security and Governmental Affairs Committee, which has oversight jurisdiction of the Census Bureau. Senators Rand Paul of Kentucky and Gary Peters of Michigan are the respective chair and ranking member of that committee. So if you see your senator listed there, just want you to know that he or she's in a very influential position and could be helpful on issues important to PAA. In the House, the Republicans retained their majority, so there were no major shakeups on the committees. But despite that, there were changes in the chairs of 2 committees important to PAA. First, the House Energy and Commerce Committee, which oversees all agencies at the Department of Health and Human Services, including NIH, and the House Science Committee, which has oversight of the National Science Foundation. On those committees, we saw Representative Guthrie of Kentucky take the chairmanship of Energy and Commerce, and Representative Babin of Texas is leading the Science Committee. Again, another committee not listed here, but important to us, is the Oversight and Government Reform Committee, because it oversees the Census Bureau in the House, and that is led by Representative Comer of Kentucky and Representative Robert Garcia of California, who was just recently appointed to that position by his colleagues. Of course, the new administration ushers in new personnel across the federal government. This slide captures some of the high-level personnel appointments of interest to PAA. A couple of notable changes, and late breaking at that. On July 11th, Mark Calabria was appointed to serve as the new U.S. Chief Statistician. He replaces Karen Orvis, who had served in the role since 2022. Dr. Orvis is staying at OMB and will serve as the branch chief for the Statistical and Social Policy branch. Dr. Bianchi, former director of the National Institute of Child Health and Human Development, was placed on administrative leave in April, and her former deputy, Dr. Allison Cernich, is serving as acting. Some notable departures include not only Dr. Bianchi, but also the director of the National Institute of Minority Health and Health Disparities, Dr. Eliseo Perez-Tabal, an institute where many PAA members had worked with him and his colleagues, and of course the resignation of the Census Bureau director and the NSF director, both of whom, by the way, had been eligible to stay in their positions until 2027 and 2026, respectively. It's not just the leadership of key agencies we've seen since the inauguration. It's also been the departure of literally thousands of federal employees, either as the result of reductions in force or because these employees have taken advantage of early retirement incentives that they've been offered. I've posted some articles. Betsy's going to provide links to all the articles and other resources I have peppered throughout this presentation in the chat and in the follow-up. But I think some of these will give you a good sense of what some of our agencies of interest, particularly NIH, NSF, and the Census Bureau, are facing as a result of this loss of staff. I have to say, for PAA, we're monitoring all of these changes and are, of course, very concerned about how the loss of so many individuals, many of whom had really irreplaceable institutional knowledge, will impact the ability of federal agencies to sustain current programs and services. The Trump administration 2.0 has really been active in terms of issuing executive orders. There were really an unprecedented number of executive orders that were issued early on. And these are some of those early ones that I think have had the greatest impact on our field are listed here. These have been used primarily as the basis for revoking previously approved federal funds, eliminating federal agencies and programs, and removing data from federal websites. And while the pace of executive orders has slowed somewhat, we continue to monitor them, particularly through the work of the Consortium of Social Science Associations, or COSA, which PAA is a governing member of. COSA has established an online tracker, which I've linked you to through this slide, so you can also access and follow these EOs. I will say what's happening vis-a-vis the EOs is really playing out in the legal space as organizations continue and government entities continue to challenge them in the courts. I think one of the most troubling steps that the Trump administration has taken to date has been to terminate external advisory committees at numerous agencies. These committees have included all three of the Census Bureau's advisory committees, as well as advisory committees at the Bureau of Labor Statistics, Bureau of Economic Analysis, and the Department of Health and Human Services. Some agencies have taken further steps to even discourage public comments on proposed policy changes, as Secretary Kennedy did when he invoked the Richardson waiver change at HHS. PAA has expressed, both independently and in coalition with our partners, our concerns to Congress. We've also reached out to the media to express our concerns about the implications of the loss of these advisory committees. I will say I was pleased to see language that just came out last week in the report accompanying the fiscal year 2026 Senate Commerce, Justice, Science Appropriations Bill, which funds the Census Bureau, asking the Department of Commerce to report back to the committee on its rationale for eliminating the Census Bureau's advisory committees and requesting a plan for how the agency will solicit and receive expert input from the public. So switching gears now, I'd like to share news with you about the fiscal year 2025 and 2026 appropriations developments. So as you know, the current fiscal year 2025 ends in approximately 2 months at the end of September. This year has been challenging given the bills were not enacted on time and all agencies were ultimately funded through a long-term continuing resolution that became law in March. Of course, the Trump administration has exacerbated frustrations by revoking and withholding funding that was approved by Congress as part of this long-term continuing resolution for fiscal year 2025. The recent passage of the rescissions package, which cut nearly $9 billion, largely from international programs and public broadcasting, has emboldened the administration to consider pursuing additional rescissions packages. I think my colleagues and I are really keeping our eyes on the next rescissions package targeting education programs, but also potentially health programs. PAA will certainly be issuing an action alert if such a rescissions package comes forward. I will say, though, that there are signs in Congress, in particular, even among the Republicans, that they are starting to push back. On July 24th, Senator Katie Britt of Alabama led a letter that was signed by 13 other Republicans. The letter was directed at OMB Director Russell Vought, urging him to fully implement the stopgap funding package, that's the 25 continuing resolution, and with special attention to the implications for the National Institutes of Health, and to provide full support for funding, providing all the funding that Congress intended for NIH in fiscal year 2025. Many of the signers are members of the Senate Appropriations Committee, including Senator Collins, who's chair of the full committee, and Senator Capito, who chairs the Senate Labor, Health and Human Services Appropriations Subcommittee, which funds NIH. If your senator signed this letter, I really encourage you to thank him or her for doing so. I will be, through Betsy and I should say, will be organizing some outreach to our members in the states who are represented by those Senate Republicans who signed that letter. Okay, next slide. This slide summarizes funding for PA's priority agencies of interest thus far. Several numbers, as you see, from the House and Senate are not available yet. That's because the House and Senate Appropriations Committee have not yet considered the bills that fund those agencies. The Senate Labor, Health and Human Services and Education Appropriations Bill is supposed to be marked up on Thursday, July 31st, so we should have Senate numbers before the end of the week. The House, on the other hand, has now recessed until after Labor Day, so we will not know their numbers for these agencies until sometime in September. There wasn't really room in this very detailed chart to include percentages or comparisons, so I just wanted to highlight a few for you. First, sort of targeting the president's budget request for 2026. He requested a 40% reduction in the NIH budget, which would take the agency from $46 billion to a little bit over $27 billion in fiscal year 2026. He also proposed continuing the administration's proposed policy of a flat 15% indirect cost rate. The president's budget also proposed the creation of a new Office of Strategy at the Department of Health and Human Services that would consolidate, among other things, the Agency for Healthcare Research and Quality, or AHRQ, and the National Centers for Health Statistics. This consolidation would result in a 35% cut to AHRQ's budget and an almost 7% cut to NCHS. The National Science Foundation received a recommended 56% cut from the administration, while the Census Bureau actually fared pretty well in the president's budget request, in which they did request an increase in funding, largely in recognition of the fact that fiscal year 2026 is an important year in the ramp up to the 2030 census, with the slated conduct or the scheduled conduct of the 2026 census test. I have to say, Congress thus far has rejected several of the president's proposals. As you see, they've outright rejected the slashing of the NSF budget. Also, on a report accompanying the Senate Commerce, Justice, Science Appropriations Bill, they included language acknowledging the importance of the Social Behavioral Economic Directorate. We're also seeing pushback on the administration's request that Congress go along with cutting NIH's budget by 40%. In fact, Senator Capito and Representative Adderholt, who chair the Senate and House Labor HHS Appropriations Subcommittee, Recently went on the record saying that the administration's 40% cut to NIH is not what members in their chamber support. I have done numerous meetings with staff and both on the committee and in personal offices who also affirm this position. It's really important you understand the role of the president's budget in this whole and the deliberations that will be taking place. It's simply a recommendation that comes from the administration. The onus is really on Congress to decide what they want to take from the president's budget and write into the appropriations bills. There's no need for them to rubber stamp. But of course, we have seen this Congress go along with a lot of what this administration has sought. So that's why you already have an action alert that's ongoing. You can access it on the PA homepage that will allow you to directly communicate as a private citizen with your U.S. representative and your U.S. senators, encouraging them to support robust funding for our agencies of interest, and of course, to scrutinize any agency reorganization proposals that are also included in the president's budget. So these are some of the reorganization proposals that we saw embedded in the president's fiscal year 2026 budget. A glaring example, of course, is the NIH, which under the president's budget would go from 27 institutes and centers to 8. A particular concern for PAA is how the president's budget proposal impacts the National Institute of Child Health and Human Development. It recommends merging NICHD with the Deafness and Communication Disorders Institute to create a new institute for child and women's health, sensory disorders, and communication. I'm co-chair of the Friends of NICHD, a coalition that advocates on behalf of funding for the institute, and I co-signed a statement opposing this reorganization given the unknown impact it would have on NICHD's research portfolio. Our statement urges Congress to hold hearings, consider necessary reauthorization legislation, and of course, to seek input from affected stakeholders. The bottom line for PAA regarding any agency restructuring proposal is that regardless of its origin, whether it's coming from the administration or from a member of Congress, that it needs to be thoroughly vetted by the relevant congressional committees of jurisdiction and informed by input from stakeholders. PAA has taken numerous steps independently, as well as a member of over a dozen DC-based coalitions, to express not only our support for specific funding levels for our agencies of interest, but also our opposition to proposed funding reductions and fast-tracked restructuring proposals. The letters and statements that are described in this slide are all available via the PAA Policy Center online. You can also access there the testimony that I submitted under my name to relevant House and Senate appropriations subcommittees in support of our agencies of interest. I have to say, many of you have played an instrumental role in communicating our funding priorities, whether you participated in our 2025 Advocacy Day, in which over 100 population scientists from 30 states met with their congressional delegations to talk about our funding priorities, as well as those who have responded to our action alerts. Thank you for your help. It's really important to have your support as we try to amplify our views on our funding priorities. In addition to advocating for funding, every year I work with congressional offices toward the inclusion of language in the reports accompanying the House and Senate Labor, Health and Human Services and Education Appropriations Bill regarding population research programs at NICHD and the National Institute on Aging. Although we haven't seen the reports yet, we won't until the committees vote on that bill in both the House and the Senate. We know that several members of the House and Senate, several of whom are on the appropriations committees, have requested the inclusion of our report language. And I want to highlight that our language received a special boost of support in the House of Representatives, where two members, Representative Debbie Dingell of Michigan and Representative Paul Tonko of New York, sent a Dear Colleague letter to the leaders of the Labor, Health and Human Services and Education Appropriations Subcommittee, urging the inclusion of our language. PA is obviously very grateful to Representatives Dingell and Tonko for their support and urges any of you who are their constituents to reach out and thank them as well. So moving away from appropriations, I'd like to feature a few examples of policy issues PA has been focusing on and leading on since the beginning of the year. Again, there have been so many issues that we've been working on, more than I can cover in this webinar, so I'm just going to highlight three. But But I wanted to assure you that there's a lot of activity happening on other fronts than those that I'm going to cover. And our commitment to working on these issues has been grounded by a resolution that officers of PAA and the Association of Population Centers signed earlier this year. The text of that resolution is pictured here, in which we identified the most egregious actions that have been taken by the new administration and urged support. The resolution is also accessible on the PA homepage in the Policy Center. An issue we led early on was drawing attention to the removal of federal data and websites. We led a letter that was ultimately signed by 230 national, state, and local organizations and 2,600 individuals nationwide representing data users, urging the restoration of taxpayer-funded finance data that had been removed from federal agency websites. The letter was addressed to leaders in Congress. We then issued an action alert, which, thanks to you, generated approximately 455 messages to congressional offices. We also issued a press release in which Irma Elo, PA president, and Sarah Brigard, the president of APC, were quoted, and ultimately that led to us being contacted by media to provide background interviews. We've also had members who have stepped up to speak, David Van Riper and John Kubali, who spoke at two briefings at the Government Accountability Office, which is, of course, the investigative arm of Congress, on the disappearing federal data. And we have responded to numerous congressional inquiries from oversight and funding staff. And while there are many challenges, our efforts, I think, have contributed immensely to the restoration that we've seen of federal data and websites. Another issue we've devoted significant energy to is raising awareness about the implications of terminated federal grants. I want to thank PAA members who have helped us by sharing their examples via our online private portal. We've used this information both informally and formally. Informally, we've used it to respond to congressional requests, and formally, we used it to inform the development of two briefs, which you can link to at the bottom of this page, both on the total numbers of NIH grant terminations, as well as another brief that provides some individual stories about the impact that the termination of their grant had, not only on their research and the progress of the research that they were conducting, but also their careers. We've shared these briefs very widely with congressional offices, including all of those we met with on Advocacy Day, and have received over a dozen follow-up acknowledgments from offices. And I really want to thank my colleagues at the University of Michigan who were very instrumental in putting together our initial brief on the impact of NIH grant terminations and poured through a lot of data. Another issue PA has uniquely championed has been calling attention to the cancellation of the Social Security Administration's Retirement and Disability Research Consortium cooperative agreements. Again, organized a sign-on letter, issued an action alert, and I've also been conducting meetings, organizing meetings, and been a part of those meetings for Bill Beach, who was the former BLS commissioner under Presidents Trump and Biden, and Wendell Primus, who worked for many years as domestic policy advisor to Speaker Pelosi, with staff on the House Ways and Means Committee and the Senate Finance Committees to urge the restoration of this program. Our more work remains on this front before we see the program restored, but it's been very fulfilling to make the case to congressional staff about the important work this program was doing and the need to restore it. I know it can be hard to feel positive during these challenging times, but it's important to remember that our work really is paying off. This slide captures some of the small and major victories we've had in the last 6 months. It's really important to remember education and advocacy works, so please keep it up because it does make a difference. Speaking of outreach, I wanted to quickly summarize some of the major outreach that PAA has done and plans to do to federal policymakers this year and in the ensuing months. Once again, it's worth mentioning the success of our 2025 PA Advocacy Day, in which over 100 population scientists from 30 states, saying it again, yes, met with their congressional delegations. We are hoping to build, with your help, upon the success of this event by encouraging ways to keep a dialogue going with those offices and staff. That's why I reached out to the leaders of the various team delegations to encourage them to share the briefs on NIH grant terminations with all of the staff they met with, and that helped facilitate the follow-up contact that I was able to share with you. To ensure that policymakers understand and use your research, PAA sponsors briefings for congressional staff, as well as analysts at the Government Accountability Office. Those events are posted here, and we are also planning a special series of webinars that we will make available not only to policymakers, but also to PAA members. With our coalition partners, PA is also supporting several initiatives to raise awareness about the importance of federally supported scientific research and the work done by our statistical agencies. I wanted to lift one of these up for you in particular. We are co-sponsors of the Cures Not Cuts campaign, which is being organized by Research America. This initiative, which kicks off next month, is designed to develop and test messages targeting key demographic groups, specifically seniors and women aged 35 to 64 who live in targeted states, North Carolina, Wisconsin, Florida, and Pennsylvania. The goal is to motivate these groups to speak out in support of scientific research and to contact their representatives and senators to do the same. The initiative also includes a coordinated advocacy campaign across all the groups that are doing this kind of work in DC, as well as an issue-based advertising campaign that will take place inside the Beltway, that is within Washington, DC. As you can see, PA is doing a lot to promote your research and to garner support for the federal agencies that directly and indirectly support the field. Now we need your help. You can always help by responding to our action alerts. And we have, as I've said a couple of times now, shameless plug for the ongoing action alert we have regarding fiscal year 2026 appropriations. It's posted in our Action Center on the PA homepage. And this link will take you directly to it. If you want to do more, I wanted to make you aware of the fact that members of Congress are visible back home during the month of August. Congress is not in session traditionally that month. In fact, as I told you, the House has already left town, so they're home. You may see your U.S. representatives and senators in your hometown attending community events and or advertising their availability at town hall meetings, constituent meet and greets, etc. If you are motivated, I encourage you to engage with these folks or their staff when they're home during this extended recess. The link I've provided here takes you directly to a concise and very helpful toolkit that our colleagues at the Coalition for Health Funding have developed to help guide you into how to conduct in-district engagement. I've featured a few pieces of advice from the toolkit here to bear in mind. If you do take advantage of an opportunity to talk to your U.S. representative or your senators or their staff, there are 4 asks I encourage you to share. You may focus on only one of them if one of these topics is particularly important to you. I will be drafting a blog sort of summarizing where we're at with respect to where we're at once Congress goes into recess and providing links to relevant background materials you can use so you can be prepared to speak about any of these topics if you do so choose to engage with your members or their staff during the August recess. Also want to encourage you to connect potentially with your own government affairs relations professionals at your local institution. They have resources and guidance as well that could be really useful. And with that, I'll stop sharing the screen and happy to take your questions. Thank you.